Hi, I'm Meshal Malik, and you're watching Indus Special. Millions of people use antibiotics in order to address health issues. But the misuse of this has led to something called antibiotic resistance. This resistance issue has become so widespread and dangerous that the World Health Organization states, and I quote, "Antibiotic resistance is one of the biggest threats to global health, food security, and development today." Now, in light of Antibiotic Awareness Week, on the show today, we talk to experts and understand what exactly this resistance is and why has it been growing in recent years. Joining us for this discussion today is Dr. Satish Kumar Deo, who's an associate professor at the Institute of Medicine at the Tribhuvan University, joining us from Kathmandu. Also joining us is Vidya Krishnan, who's a health and science journalist, joining us from Goa. Thank you both for joining us and welcome to the show. Dr. Deo, let me begin with you. Now, for the audience at home, explain to us, when should antibiotics be used and what is their basic purpose?
Thank you so much. Whenever any disease is there because of infection, mainly for bacterial infection, antibiotics are used. So disease may have occurred because the bacteria. To kill those bacteria, if the drugs are used, those are called antibiotics or antibacterial drugs.
Right. Now, what happens when these drugs are used in excess?
Yes. See, bacteria are also a sort of microorganisms. These are microorganisms. So when antibiotics are used excessively, what will happen is the bacteria try to defend themselves in such a way that they develop immunity within it. And with some sort of genetic modification, they develop a capacity to fight or resist against those bacteria, antibiotics, which were previously active in that time.
Right.
So eventually, the antibiotics develop a resistance to it, which were found to be useful in a previous time. So this excessive antibiotics of use, or the irrational use of antibiotics, is a major cause for development of resistance.
Right. Now, as you're stating here, an excessive use is, of course, damaging for the human body. I'm going to jump to Vidya and talk to you about this. Vidya, now, you've been covering health for quite some time now. And as we discussed, antibiotic resistance is being seen as a global threat. Why do you think we've reached that point? What has caused people to consume antibiotics in such an excessive amount?
There are historical reasons why India in particular is one of the world's leading consumer of antibiotics. South Asian nations consume a lot of antibiotics as well, and there are historical reasons because any country which has a history of traditional medicine is likely to self-medicate more. Okay, those homemade remedies. So it's socially acceptable that you start treating yourself. And then post the colonial empire, we've had both India, Pakistan, this is true for Nepal, this is true for Bangladesh, that we've had very little investments in public health. And there is over-the-counter medication. So you can just go to a pharmacist and buy yourself antibiotics and treat yourself, even if you have a viral infection. And like Dr. Deo was saying, historically, the reasons have combined with low investments in public health sector. And that has now combined with, we've reached this point where there are superbugs. And increasingly, we can't treat diseases that were easily treatable earlier.
Right. Now, Vidya, you provide a very holistic overview of why this is happening in this region specifically. But as I discussed before, and as this World Health Organization Awareness Week has basically been geared in order to shed light on the fact that this is a global issue. Now, what I want to understand is, do you think there are some complex market factors at play that are causing consumers to reach out to antibiotics more than, let's say, 10 years ago?
So there are studies that now prove that it's in fact urban consumers who use antibiotics more than rural consumers say, I know this is true for Pakistan and this is for sure true for India, where in rural India you can't go and buy, there is no doctor, you can't go self-medicate as much. So the more liquid cash you have, the more likely you are to have access to a doctor, and the more likely you are to over-medicate yourself. And this is a global threat because this is a globalized world. So India in particular is now facing a crisis of drug-resistant tuberculosis, which we are exporting because we have diasporas in every part of the world. And you are a flight away from a drug-resistant patient showing up in Japan, which has happened. In Italy, it has happened. So patients are showing up in different places. And drug-resistant, antibiotic resistance is not something which is one country's problem. This is not something, when a bacteria mutates, it will not respect geographical boundaries. Nobody is safe until all of us are safe. It is a global threat.
Right. Dr. Deo, now, as Vidya points out that the mutation, these bacteria are not constrained by geography. When it impacts one person, it is bound to spread across the world. But I want to move back a little and continue to talk about this point. Why are we seeing it spread at such a great speed? Now, Vidya pointed out self-medication here, consumers going and reaching out for over-the-counter drugs without prescriptions. But reports and studies also show that doctors often misprescribe antibiotics to patients. What do you think that is because of?
Country like in South Asian countries, antibiotics are irrationally prescribed, and there are sufficient evidences that suggest that these are not well prescribed. The probable reason for one of these things may be because there is lack of use of standard treatment protocols. And very often that the microbiological tests that need to be done are not sufficient or may not be available all the places, and there is empirical use of antibiotics, which may lead to irrational antibiotics use. Right. So you have rightly pointed out that even as the drugs are given by OTC, over-the-counter drug, along with that, it's equally true that there is a high chances of prevalence of having an irrational drug because of multiple reasons. That maybe one could be one of the lack of use of standard treatment protocols.
Right. You're mentioning how there is a basic protocol that doctors follow, and we've been focusing a lot on this region as well. I want to understand, are there any corporate reasons? Now, we hear about pharmaceutical companies being extremely powerful, having great influence over doctors, over hospitals. Are there these reasons, corporate reasons behind why doctors are prescribing more and more antibiotics?
One of the major investment that the pharmaceutical industry does is for influencing or inducement of a prescription to a physician. And this will equally applicable in the antibiotics too. So probably there may be a corporate reason that the inducement of use of antibiotics, or the antibiotics which are for the last resorts, are used.
Right.
Maybe, and by their explanation saying that the antibiotics are rational for that particular case. But the evidence suggests that actually there is no need of going for a higher group of antibiotics.
Right. Vidya, to that same point, when talking about corporate interests forcing people to indulge in prescribing certain drugs that, of course, align with those corporate interests, is that one of the reasons why we're seeing a surge in prescriptions of antibiotics? And I don't mean over-the-counter patients going out self-medication. I mean doctors prescribing antibiotics.
Yeah, this is a disastrous situation that we are in. And a disaster of this scale is a collaborative effort. So the government is to blame, the pharmaceutical company who are in this for profits and are not being regulated are for sure to blame. And then there are private doctors who themselves do not, like Dr. Deo was saying, do not follow a protocol. So there's enough blame to go around for everyone. But I personally think, as a journalist looking at this so closely for years, before I would blame a for-profit pharmaceutical company, the question that I would ask the government is, why are you not auditing? Why are there not prescription audits? Why are you not training in doctors who have this nexus with medical representatives, and there is incentivization of overprescription? Why is rational prescription of antibiotics not a priority? Because this is a government that is not acting in public interest of its citizens. And so the pharma companies are taking benefit of it for sure. But as citizens, we have to start asking questions to our governments first to make sure they ask to the pharma companies.
Right.
Yeah.
Right. Now, Vidya, as you stated here, there's enough blame to go around, and there are many people who are collaborating in what we're seeing become a crisis of our times. Now, where do you think it needs to begin? You mentioned that the governments need to audit doctors, audit hospitals, they need to question doctors. But we also know in places where there are medical emergencies, this may not be a practical solution. What way do you think we need to tackle antibiotic resistance?
In fact, I think these are very practical solutions. If you look at health systems that work, which is the NHS in the UK, or even in the US, which has a lot of problems with their health system, you can't go and buy really strong antibiotics off the counter. These are solutions that are being done in parts of the world. I was reading about this research in Australia, where they were doing a behavioral economics study in trying to get doctors to prescribe less, where they were simply sending out a pamphlet to neighborhood clinicians saying, in your area, the neighborhood doctor, the other doctors prescribed only these many antibiotics in this month. Compared to them, this is how much you are prescribing. And things like that are, WHO is experimenting with this. There is an antimicrobial secretariat within WHO that is looking at behavioral science for solutions. It is looking at culturally specific solutions. But then we cannot keep saying that this is not practical because our health systems are so bad. This is a system that is a very basic, fundamental starting point for every health system around the world, except for in South Asia. And we have to start asking questions and
so Vidya, you're focusing, right, I take your point there. You're focusing on the supply side of this, that there needs to be more stringent checks, more stringent restrictions on being able to access antibiotics. Dr. Deo, while we're talking about this, of course, it is important for the consumer of these drugs to also be aware of what is happening. What do you think is essential to happen for that awareness to increase about what antibiotic resistance is, about how to prevent it, how to avoid it, what questions they need to ask their doctor or health consultant when they go to them?
See, in my view, first of all, what we need to understand is what will be the consequences after 30 years, 40 years, that what people are going to face. If they have some idea in their mind that we are coming up with a post-antibiotic era, that means none of the people are going to treat by any of the drugs available in the world now. And if post-antibiotic era comes, what will happen? It's a simple thing. The death of the cesarean section will increase by 10 to 15 folds. The orthopedic surgery, including any kind of graft or any kind of stents, this will not be possible because there will develop an infection.
Right.
Lastly, I will say that even the mother will not allow the child to go and play outside the room because of injury. The time for a healing of the wound will be maybe very long or may not heal. So if these things are very clear in the population that we are going into we are in the age of the slow-moving tsunami, rightly said by Director General of the WHO. If people know that the consequences is so devastating, then people will understand that you have to ask these questions to a doctor. They will not go and take from any pharmacist and antibiotics. They will start taking a prescription drug only and start asking that what is the reason for antibiotics given to me and how many days I have to take this antibiotic, so that I will be not responsible for development of antibiotics in the future.
Right. Dr. Deo, now you mentioned something here which is also a question that comes when we talk about antibiotic resistance, is the duration of the course in which the medicines need to be taken. Now, how important is it to follow that specific course timeline?
It's very, very important. The reason for this is, suppose a patient has some sort of infection and antibiotics is given, and there are millions and millions of bacteria that is responsible for it. Within 2 days of time only, the patient becomes completely asymptomatic for the 5 days course. But there are still some bacteria which are still living in that. And if the course is not completed, those remaining bacteria have a tendency to develop a genetic changes that leads to resistance. And that newly mutated bacteria is so powerful, we can say this as a superbug, and in subsequent days, same antibiotic will not work. So it's very important for all the patient to understand that complete full course antibiotic should be taken as per doctor recommendation.
Right. Vidya, now, as we were just saying, the point of awareness and how to spread awareness amongst people and consumers who will be consuming these antibiotics. What do you think needs to be essentially done by governments and various stakeholders involved?
We changed our public smoking laws overnight, and people are not stupid. Like Dr. Deo was saying, parents care that their children should not fall sick. This is the responsibility of the doctor and the government to make sure that parents realize that you have to complete your course. But an information and education campaign, all of these nations, Pakistan has done it, India has done it. We do it for polio, we do it where we want and where we have political will and where we prioritize. We've done wonderfully in those cases. This is just not a priority. And like Dr. Deo was saying, we are in the post-antibiotic era. In 10 to 20 years, experts say we will lose medicines known to modern science. So you'll walk in with a minor infection and or have a jaundice that can't be treated anymore. So right now is the time for governments to prioritize this. The solution has to come. I don't think the policy change is the problem. Political will is the problem. Because patients are never stupid who, if you give them the full information, they never say that we still have to engage in self-destructive behavior.
Right. I take your point there. Dr. Deo, last question to you. Now, as you mentioned there, and Vidya also pointed out, agreeing with you that we are in the post-antibiotic era and we are at the risk of developing certain illnesses and diseases that we might not be able to cure. This is a very alarming situation. Now, what do you think urgently needs to be done in order for there to be a realization of this, for there to be an implementation of policies, and to try to tackle the situation we are in?
See, actually, if you see the action against antibiotic, although it was started from 2000 onwards, from 2015 onwards, WHO has given a very straight, clear-cut guidelines to tackle against AMR. It is called as a global action plan, and all the countries have already developed their national action plan to fight against it. The areas are very clearly sorted out. The first one is the awareness. It's awareness to general people, awareness to even the medical fraternity, awareness to doctors, awareness to politicians. So everybody needs to aware that this is going to happen and you have to take this very seriously. Second thing is the surveillance. Whatever the treatment antibiotic use that should be done should be based on the microbiological data that is generated. And the WHO have established a GLASS global surveillance networking. So that GLASS networking helps us to tell us that what sort of infections are developing and what sort of antibiotics should be given. Number third is the infection control and prevention. First one, the most foremost important, antibiotics are used because there is an infection. So if you minimize the infection rate, use of antibiotics will automatically reduce. Use of hand washes, use of sanitizers, use of neatly cleanliness, aseptic environment, sterile environment, these are the very clear-cut ways. Fourth is the stewardship and the rationing of drug. You have to promote rationing of drug. The pharmacist should not have authority to give any drugs unless and on prescription is done. It should be entirely based on the prescription. If those things are clearly monitored, that is the one thing. And overall, this is something called as One Health approach. We have to realize that it's not only human that is responsible for developing antibiotic resistance. The use of antibiotics are rampant in the agricultural field. The use of antibiotics is rampant in the animal field. So if you have and there are certain traces of antibiotic resistance which are found in water, that means it's in environment also. So if you address all these four components together, that we have to tackle this in One Health approach, the solution is there. As Vidya has rightly pointed out, there are so many documentation which has been done so far.
Now, since I'm short on time, I'll have to ask Vidya a last question before we wrap the segment up. Vidya, as Dr. Deo mentioned, that this is not just specifically related to the diseases and the human body, we're also seeing our food systems being eroded by antibiotic resistance. Could you just quickly shed some light on that?
Again, India has the dubious distinction of being the leader in that. We have a lot of, we make generic drugs in India. So what's been happening is the waste material from the industry, because there is no regulation again from the government, is from the pharmaceutical companies is being pumped into our water, where we consume our water, especially in Hyderabad where our pharma companies are. So we see antibiotic resistance in livestock, then we eat that chicken, and that further perpetuates it. This is basically being reinforced and multiplied over and over again, because the food we consume is not safe, the water we drink is not safe, and then the medicine that we are taking is not rational.
We're going to go for a short break. When we return, we're going to have another story for you. Stay with us. Welcome back. Now, an estimated 2 billion people, according to the World Health Organization, have no access to essential medicines. This means 2 billion people around the world cannot benefit from which can save their lives. Why is it so? With so much research and development, communication, there is still such a major gap between the people who can access medicines and with all the development that we're seeing. That's our discussion today. Joining us to discuss this is Dr. Nabi Tayyab, who is the Professor of Medicine at the Department of Health Government of Punjab, joining us from Lahore. Also joining us is Dr. Sonya Saleem, General Practitioner, joining us from London. Thank you both for joining us and welcome to the show. Dr. Tayyab, let me begin with you. Now, when we're talking about these price hikes, we're talking about affordability, we're also talking about availability. What do you think is causing for so many people not to have access to life-saving drugs?
We have two issues at our hand. One is availability, the other thing is affordability. As far as the availability of the medicine is concerned, majority of the antibiotics are available in Pakistan, and it's not just available in the country, rather they're available so readily on the medical shop that everybody can go in and purchase the medicine and use it at its own. And here the problem lies. You see, in any decent healthcare setup, the antibiotic use should be fairly restricted. It should not be accessible to a common person who is naive, who doesn't understand the complications and intricacies of the use of antibiotics. Now, in our country, we have a culture, we have a habit of using antibiotics for every small symptom. Now, let me give you an example. A common example is the flu infection, the viral infections, which we all bound to have in 3 to 4 times every year, or maybe 6 times every year. Now, every time we get an infection, the fever comes up, and fever comes all of a sudden, it comes very high, 304 degrees Fahrenheit, maybe 101 degrees Fahrenheit. Now, a sudden fever obviously causes panic in the family. It causes panic with the person who has acquired the fever. His natural instinct is to get over this infection. Since the reflexes of this society is such that every time you get a fever, you like to get rid of this fever as early as possible. And it's a myth in the society that you have to take the antibiotic.
Right. Dr. Tayyab, you're rightly mentioning here how this has become very frequent, the use of antibiotics. And in the earlier segment, we did talk about this in greater depth, how that is damaging people. But when we're talking about other life-saving drugs like insulin, certain cancer drugs, there is a noticeable price hike in them. Prices seem to increasingly go up, and the affordability for the general population goes down. What is causing for these price hikes?
Okay, that's another thing. That's a total different spectrum altogether. You see, when we talk of the affordability, the price of medicine is also going to match with the market dynamics. If the raw material, the import prices have gone up, the manufacturing prices have gone up, the pharmaceutical companies have to increase the price to maintain the sustainability of their company and then profitability of the company. If you're going to take away the sustainability and profitability of the company, let me tell you, the availability of these medicines definitely going to go down. But this doesn't mean that I'm defending these pharmaceutical giants, I'm defending pharmaceutical companies. There has to be balance. The balance has to be brought in by a strict management by the healthcare agencies. And healthcare agencies mean the government of Pakistan, government of Punjab, government of health. At various levels, they have to make sure that even if the price hike comes, the price hike should not be at the cost of taking away the facility from the patients, because definitely these medicines are life-saving in a person who's suffering
Dr.
from
Ghais and Nabi, Tayyab, this is a very interesting point you raise, how there is, and for there to be a certain price standard for these companies to be able to sustain themselves, to be profitable. Now, when we're talking about this is the question that comes into play. Is it that they are trying to sustain themselves, or is it that they're trying to make an enormous amount of profit, that too at the cost of human lives? Dr. Sonya Saleem, I'd like to take this question to you as well. What do you think about this?
Well, in the UK, we have the National Health Service, so everybody is entitled to access to medications, because at the end of the day, we do pay taxes into the system. So essentially, everybody should have access to these life-saving medications, for example, insulin, and also cancer drugs as well. But what we have noticed is that some cancer medications, because they can be incredibly expensive, there are certain pockets within the country, certain CCGs, that won't necessarily permit the use of these medications. So each case sort of has to be taken on a case-by-case basis. So if somebody wanted to have a very expensive form of cancer medication, a case would have to be put forward to the local healthcare team to see whether or not the benefits of that medication would actually outweigh the massive cost.
Right. Now, Dr. Sonya Saleem, you mentioned the national health system here. Now, Britain is also undergoing an unprecedented drug shortage. What is fueling that?
Well, there's a lot of uncertainty at the moment. For example, the issue with Brexit. We still don't know whether we're going to be leaving the EU or not, and it's been almost 2 years since the talks began. So not only are patients starting to worry. For example, I have a lot of patients coming to see me and asking that, maybe they should be stockpiling their medications because, if the trade movement is restricted, then perhaps, they might not be able to access some of their medications. So I think there's a lot of uncertainty at this moment in time. So I think that's one factor responsible for shortages in certain medications.
Dr. Sonya Saleem, now you talked about the anxiety that is very, very palpable amongst patients who are wondering whether they're able to access these medications or not, given the uncertainty that prevails. And that's the emotion I want to tap into while we're having this discussion. That emotion that drives people to go out to the pharmacy, try to reach drugs, go to different doctors, but not being able to afford them due to various factors. Now, we're talking about policies wanting to change, needing to change, but at this moment, if there's 2 billion people who can't access medicine, there's something terribly wrong in the system. Dr. Tayyab, where did we go wrong? Now, with so much research and development, of course, there must be a way to make this accessible, make medicines more accessible, and not just in developing parts of the world. We're listening to what is happening in the UK.
You see, these are two clear-cut, distinct industrial interests. On one side, we have got the health industry. On the other side, we've got the pharmaceutical industry. On the pharmaceutical industry, whenever they are investing their money on the development of a drug, they want to get the benefits out of it. On the contrary, in the health industry, the regulators, they want to provide the medicine to the patients on a price which is affordable, and not just affordable for a single patient, but affordable to the healthcare system as well. Unfortunately, in Pakistan, we don't have a healthcare system like the National Health Services, which are there in UK or in Canada. But whatever we have, I think a better regulation is required. There are certain medicines for which the health regulators, meaning by the government, have to bring in a policy where they have to force in a short-term or maybe in a long-term policy way. Maybe they bring in more competition on the long-term side, that a single molecule may be manufactured by more than one company, but on the short-term side, they need to force the company to market the price to market the drug at a price which is affordable for the consumer, and not at a price which is totally exorbitant and not affordable for a common man. One has to look at the general income status of the patient, right, or the common person, and then the health needs of the person. This is something which is doable. The only difference is that in our scenario, since National Health Service is not in place, in the coming days, maybe the insurance system may be in place, and that may be a way towards the National Health Service in the coming days. But right now, it is an open market, and in the open market, government has to set up a strategy, a short-term strategy and a long-term strategy. In the short term, just the negotiation with the companies for a better pricing, and the long term, more companies manufacturing the same molecule so that they may be able to market it at a competitive price. That's the only way that we can go in.
Right. And you're talking about having a national health insurance plan and how that's missing. Now, I do want to talk a little more about that. The number of people who miss out on basic healthcare facilities because of not having this insurance, not having this backing by the government. Dr. Tayyab, give us a sense of what is happening in Asia right now.
Well, the basic concept of the national insurance scheme at the moment is that they should be given an insurance card, and they may be able to go to a health providing facility, and by showing the card up to a certain limit, they'll be able to, and they will be entitled to get the treatment. And that it covers their operations, it covers their basic health problems, and then at the same time, they're giving the guidelines on treatment of various ailments as well. So that's a good program, that's a good plan. But then right now, it is covering just those people who have got an income level less than the I should say 25,000 per month, and in the coming days they may be able to increase it to something better than that, maybe 35,000 or 40,000 per month. In the people who have got a better income, the government and the other insurance agencies offer them the health coverage either through the departments or at the individual level by paying the premium on the annual basis. But this is something which is coming in very slowly, and right, government is working on that. And maybe in the next 2 to 3 years' time, they may be able to cover the poorest of poor in the population in a good way. But currently, I should say that few districts have been covered, and majority of the districts have yet to be covered, especially the bigger cities have to be covered.
Right. Dr. Sonya Saleem, now when we're talking about people who are left behind in this, and Dr. Tayyab mentioned how there is a certain standard or a certain limit for those who can access healthcare insurance, get health insurance. Now, how important is health insurance for everyone, regardless of their income level, regardless of their gender, their age? How important is it to have health coverage?
So I actually work in a very affluent area in Essex, and the majority of patients that I have, that I see, actually have private health insurance. Now, it's important to remember that private health insurance, it doesn't cover any sort of acute emergency. So, for example, if somebody is experiencing abdominal pain and they need to be seen by the surgeons as soon as possible, usually covers more sort of chronic conditions. So I wouldn't say it's essential, especially in this country, because you know, anybody can step into A&E, and fair enough, the waiting times in accident emergency departments are quite long, but nevertheless, everybody has access to the healthcare system. It's just that if you decide to go for private healthcare insurance, you might be seen more quickly by a specialist, for example, a cardiologist or an endocrinologist. So I don't think it's essential in this country, but for those people that, let's say, for example, would like a knee replacement as soon as possible rather than wait a couple of weeks or a couple of months on the NHS, and that might be a better option for them. Because why wait for a couple of months, you know, being in pain, not being able to mobilize and being more stiff, when you could actually be seen by a specialist much sooner.
Right. Dr. Tayyab, now I'll go back to a proposal that was put by the Italian health minister, in which it was stated this proposal was, of course, backed by many countries from the developing and the developed world. It stated that the research and development costs of big pharmaceutical companies should become more transparent to the public, because many pharmaceutical companies claim that the reason there are such high prices for their drugs is because there goes a lot of effort, a lot of money into the research and development, but no one really knows exactly how much. What do you think of this proposal?
I entirely agree with this concept that the audits of the big pharmaceutical giants should be done more comprehensively. Unfortunately, in Pakistan, there's not much of research and development on the pharmaceutical side in the pharma sector. Either it is the international companies bringing in their medicines and marketing their medicines in Pakistan, or alternatively, the national companies, they are manufacturing the same molecule. To be honest, this problem is not there for Pakistani people, but definitely in the international circuit, when we look at the international scenario, definite need of looking at the
Dr. Tayyab, but sorry to interrupt here, but the drugs that are supplied within Pakistan as well, aren't they also part of a larger global system in which there are certain pharmaceutical companies that have a powerful monopoly over, for instance, let's say insulin, the production of insulin? So whatever happens globally, doesn't it impact Pakistan at the end of the day as well?
Definitely, it is affecting the Pakistan indirectly as well. The big pharma giants, for example, the companies like insulin-producing companies, antibiotic-producing companies which make anti-cancer drugs. What they do is that on the international circuit, they market a price and then they try to sell on the same price as it is in the developed countries. But then, since the research and development is not there in Pakistan, so whatever we're getting through these multinational companies, that is because of their marketing in Pakistan. And then at the same time, we have a healthy national pharmaceutical companies as well, which make Me Too drugs, and through these Me Too drugs, they make a decent profit. Rather, I should say that they make a very healthy profit in that.
Right. Now, our discussion is very interesting in this regard. We're talking about how and why so many life-saving drugs are inaccessible for the general public, whether it's affordability or its unavailability. And this is an issue not just plaguing developing parts of the world, but also the most developed parts of the world. Now, we're going to have to end the discussion here. Thank you so much, Dr. Ghais and Nabi Tayyab, for joining us, and Dr. Sonya Saleem for joining us. We will, of course, cover these topics in our shows later, but that's all we have for Indus Special today. Thank you for watching. We will see you again tomorrow with more stories. Till then, goodbye and take care.